So welcome back to O.M.A Medical Studio. I'm Ebenezer and then
I'm Dixon.
all right. So today we are taking you guys through self medication. I mean this has been a problem that has been there. You understand? Day in day out, we all go to some over the counter medical sellers. We have some headaches. We self diagnose ourselves and then probably we see our symptoms and feel like this we get to the pharmacies or the over the counter medical sellers and then get some medications just to relieve ourselves. Or sometimes we don't even intend to go to hospital. So we just want to get treated, we just want to treat ourselves. It could be, I mean, so many factors can lead to this kind of things. All right, so today that's what we want to take you guys through. That's what we want to discuss. So let's begin by defining what self medication is. Like I said, we all do it. Everyone does. But then today we are looking at the factor that leads to it and also the negative impacts. That's basically going to do on our focus. The negative impact that self-medication has on the health sector, has on the individual, and even on the government as well. All right, so let me read this to you guys. All right, so self-medication is defined as the selection and the use of medicines by individuals or a member of the individual's family to treat self-recognized or self-diagnosed conditions or symptoms. So, like I said earlier on, we see our symptoms, we observe our symptoms, then we basically diagnose ourselves. Then we go to the over the counter medical sellers, or it could even be a pharmacy. Then we just tell them that sometimes you don't even tell them what you are going to, you just tell them this is what you want to buy. Yeah, it could be anything. So I just don't want to just hit on the factors. But for now, this is the definition. Selecting a medication for yourself just because you have observed your symptoms and then you think a medication cannot do away with your symptoms, or you have diagnosed yourself and you think a medication can help you. So you go to the pharmacy or the over the counter center and then you just get your medicine.
Okay, so can we quickly run into the factors that sometimes lead into self-medication? So we can have this urban or rural residents.
Okay.
Yeah, the urban or rural residents. So
Basically, those I mean that has to do with the area of the person.
yeah,
Probably like you said, there are so many factors. The reason why the person is basically going there is the person doesn't have access to
yeah,
maybe a health facility or something. So the first point of call is basically the
drugstore.
drugstore. I mean, my village. So before you get to the hospital, Charlie, but in and out will be like I can't get the bill. I mean, this person is thinking, this person doesn't have insurance, thinking about going to the hospital and with the fear of even admission and all of that. And when you come to the urban areas too, the cost, probably maybe the closest hospital to the person is car.
Whoa.
So, like I have headache, I can't say
So it's
car.
better the person is
So,
okay.
I mean, your residents also what account for this kind of things. And then the second
We can
factor,
talk about the health insurance also as a risk factor.
okay,
Yeah, risk health insurance. Maybe this person health insurance has expired, maybe like 20 years ago, correct? Because the person doesn't feel sick only. You know, I was having a friend that told me that he the day he renews his health insurance, the day he falls sick. He falls sick.
we never go in.
No, please. So when this happens, so if your health insurance has expired, the person looking at the stress in renewing the health insurance before getting to a health facility. So the person is, why don't I just go to a nearby drugstore or pharmacy, get medication for myself, then treat myself? So health insurance is also one of the factors.
Yes, it is. Well, okay. Probably if I don't have insurance, okay, so people, so first of all, we've spoken about the residents, whether rural areas or urban areas, listen about whether the person is insured or not insured, or the medication basically the person needs is
Is it
under
insurance
insurance
or
scheme
not?
or not. Okay,
Yeah,
that can lead to that. And then age,
yeah.
age too can lead to that. I mean, if you are old, you are very old, especially the elderly people, the stress in taking these people to hospitals, and then I mean, if they don't also have the money to just take for themselves personal doctors or physicians or nurses, basically becomes a burden rushing these people to hospital. So their caretakers may just run into a drugstore or a pharmacy and explain the symptoms to them, and then they will just get medications for them
Yeah.
as well. So age is also one factor, and then gender.
Gender.
Gender is very
Yeah.
controversial. But
But it's even ladies. No, but me, I feel like the male gender that do that most.
well, that one, but studies they do it.
Yeah, they do, but oh well.
Studies they do.
But don't you
Studies
think
they be helper.
it be help? Aha, for them it be help.
The helper people can't talk say this thing is pure.
This, then we just
Gender be controversial
yeah.
factor. Alright, then we talk about educational level. Yeah, that's a very key factor. I mean, see, this one, we all, whether you're educated or not, I think we all do this thing. We go through, I mean, me as health workers, right? How many times we force them they go on hospital? You you that you see the complications, they will tell you all the conditions you have. But I mean, all these things are not right. They have as they have their negative impacts and then as well some few positive impacts. So we will rush through all of that. Then occupation. How does occupation lead someone to self?
Yes, occupation is also a factor. Why? Because I had a certain friend, his father is a farmer. But where the father farm is a typical village, right? Now, when the father goes out early in the morning from 6 a.m., 6, 7 a.m., he comes home like 6 p.m. So when he comes back and he's having this waist pain, general body pain, he wouldn't get time to go to hospital. Maybe he might just send his son or his child, go to the pharmacy and get me a painkiller. So occupation also plays a vital role. It's also a factor in self-medication. Yes. So occupation is one. Yes. So that's how occupation too can put a person at risk of getting self-medicated.
Alright, you already if you are working at a place you are not getting time to take care of yourself as far as your health
Health
is
is
concerned,
concerned.
must have stop.
Oh, not so, but at least. Yeah.
So we've spoken about basically maybe about six factors: the residence, the health insurance, the age as a factor, the gender, which is a very controversial factor, then the educational level, the occupation, the income. I mean, if I don't have the money, like already I don't have insurance. I'm thinking about the distance, the transportation where I have to pay to get to this particular health facility. Then I look to my right, there's this close by
Drugstore,
store
pharmacy.
where I feel like I need to get a relief. You see, mostly I feel like we get to do these things because we want to get relief
Yeah.
or something. I've realized that I mean there are two basic things that brings people to hospital: pain and the rest. You understand? Pain accounts for almost 90% of these cases. If the person is not in pain, the person will not come.
Sure.
So if I'm at a place or probably I don't have the money, I don't have the means, the little money I have, I just put my eyes somewhere and I see there's a drugstore there and I can get the medication to ease my pain. Once the pain is gone, I might not even be tempted to go to the hospital.
Yes.
So that's income is one of the various factors to that affect. All right. In as much as we are talking about self-medication, it's not being good or something, there's always, I mean, they say there's this people say, I mean, about rumors. When rumors become there's a bit of truth in
Within it. Yes.
maybe I'm not saying the right thing, but then the point is that in as much as it is not good, there are some few positives that we need to highlight when it comes to self-medication. For instance, we have I'm not saying this for us to go and do it, you understand? But then easy access to medications for the person to relieve him or herself. It even tells you that the person has his or her health in mind. Like it's not everybody that will pay attention to their health, whatever they are going through. They will wait till it gets to the severe state before they try to pay attention. So for the fact that you remember that my body is not well, I need to get these things, at least it helps. And then easy access to medications. I mean, they just go to the drugstore, they get it. And all of that. And also when you come to the government side, some minor conditions, people will get admitted to the hospital and then they will accumulate huge cost. They feel like I mean when I walk to the drugstore and I get this medication, it eases the burden on government as well. But I mean all these things also helps in a way, but then I don't think it helps the individual
so much. Yeah.
so let's just get into the negative impact of these things for the
Okay. So we have the potential risk for self-medication practice. So one, we can talk about the incorrect self-diagnosis. Yeah. So most of the time you hear them they say a patient will just come walk into the facilities. What's wrong with you? Say I have malaria. The thing is, what
that's
makes
basically not at the hospital.
no. I have malaria at the drugstores or a pharmacy. I have
But
malaria.
do people like as a doctor they are not patient, but then do people really go to the pharmacist and then tell them they have malaria? Or they
Yes,
just go there to buy medication for their
listen,
symptoms?
they come. I have there's this pharmacy. He's a pharmacist. He is very good. When you come and you tell him your symptoms, he will tell you that initially when you come, oh, I want to buy this. I'm having headache, so I want to buy PM. I want to buy this. Then you ask, what's wrong with you? Then instead of the person saying that I have headache, I have fever, the person will just say, oh, I have malaria. Then you want to probe more and ask, what shows that you have malaria? Because I have bitter taste, I have fever, I have headache, all those stuff. Yeah, but you see, not all headaches, fever, bitter taste actually points there to malaria. Yeah, so they improperly diagnose themselves and that is a potential. So
Yeah.
yes, you go and take a medication that actually maybe isn't meant for another condition.
Yeah, you just misdiagnose yourself.
So yeah,
All right. So then the second one, basically delays in second medical advice when needed.
yes,
Very true. Very true. All the time you waste going to the drugstores, getting the medications, taking it for some number of days, it's not working, the symptoms are not improving, then we still go back, we tell these people no test is done, we are being given another form of medication, we just come back, we take, and it's still not working. We pass through a lot of processes. Then ends up in the hospital finally. Now let's accumulate the cost that has been there
yeah.
since the time of the symptoms, the onset of the symptoms, to
Now
the
you
very point to get to the hospital. You are now coming to accumulate whatever you are trying to prevent.
you're incurring a new cost.
So you are misdiagnosing yourself, you are incurring cost to yourself. All these things are negative impacts of self-medication. So all these things should try and tell you that see, it's better to get to the hospital for the necessary things to be done than be buying medications from the drugstore where you don't even know what's wrong with you. Understand? All right, then we have infrequent severe adverse effects.
Yeah. But I think that does not always. Sometimes it's rare. Or how will I say? It's rare. It's rare.
The point is that the point is not about how rare or how
Frequent it
frequent
happens.
it is. The point is that you could suffer from a
From it.
side effect.
Yeah.
But you know when you get to hospitals, certain questions are asked whether you have taken a particular medication whereby you have reacted to it or do you have a particular condition in which a certain medication is contraindicated. So at the end of the day, there are certain medications that are not supposed to be given. You are not going to tell that to the pharmacist. They might not even ask you. How many pharmacists will ask you when you are going to buy medication and then they will ask you, do you have any? They won't ask.
Yeah.
So you are just being given the medication. The moment you start to react, you might even die.
Yeah.
Especially if the reaction is very severe, you might lose your life. So I mean, all these things should tell you something. All right. Then we have incorrect dosage. This
Yeah.
one is the herbal pill.
No, it's not only the herbal people.
It can give you a gallon. Take it a day.
Indeed. Yeah. But I also have this my uncle.
The herbal.
He is not herbalist. At the village, every December go to the village. This man, he's a farmer. Yeah, he because of the farm, the heavy work, he comes with headaches, body pains. He takes PMO 1 gram TDS. Later he got to realize no, he said the 2 gram is not working. So he can just take like 4 grams. So he was taking 4 gram TDS.
You need to be arrested. No?
4 gram. But you see, that time
He is abusing the pharmaceutical company. He is not abusing the medication. He is abusing the company.
Obo Obo car.
Nah, that's serious. No, that's serious.
But then, like, I didn't have any knowledge in health. Yeah, we would go there just Christmas, then we come back. It was taking like 4 gram TBS.
That's
You know,
huge.
yeah, that is 1 gram isn't working. The 1 gram TBS isn't working. So if
You know the daily maximum dose of pasta.
no,
That be 4 grams, bro.
so this
They
man,
think the 3 times of the maximum dose.
so you see, but if you had gone to a health facility, at least yeah, they will know what to do. Yes,
Probably the headache. You see, the point is that it's not about the symptoms. When you go to the hospital, it's not about the symptoms. It's about what is causing the symptoms. That's why it's more advisable for us to get to the hospital once
for
we
a
are
proper
suffering from
checkup.
something.
Yeah,
The symptoms are there to tell you that there is something wrong in the body. There is a stress in the body. What is causing that stress? That's why you get to the hospital. Not because your head is aching you. And we use these symptoms as a mark, as indicators to know that the medications we are giving you are working or they are not working. So you think whatever is happening in your body brought you headache, brought you vomiting, brought you diarrhea. You come to the hospital and you're able to find out what is causing it. You are supposed to improve on the symptoms. Okay, the diarrhea has subsided, the vomiting has subsided, the headache has subsided. Then we know we are doing something. Sure. So it's not always going to the. I mean, when you get to the drugstore, they will give you anti-vomiting drugs.
right.
There are sometimes all these things are not
Not
needed.
needed. Yes, immediately you tackle what's causing the
Yeah, yeah, you understand. So looking at all these things we have heard, we should be able to make very good decisions concerning our health. All right. So make and then I mean, the condition has started, mild situation, just not so condition. That's why with medications, self-dosing, then it becomes severe. So making a very mild condition get to a severe state, then
Yeah,
I mean when it gets to a severe state, the cost also increases. Yeah, the hospital, the bigger your disease, your condition, the bigger your price.
yeah, but
That be the issue. So at least these few reasons you've spoken about should prompt US or probably we all
yeah,
to take notes on our health concerning medication. And the last thing I would want to say is that every medication is a poison.
sure. There's a potential
Poison put in the right amount to deal with something in the body. The moment you take it and that thing is supposed to deal with is not in the body, that is when misdiagnosis comes in. It's not in the body. Then it means probably it's going to cause something. It's going to be a waste. Yes. And any medication that becomes a waste in you can build up to become toxic. And at the end of the day, it will harm you yourself. So self-medication has a very bad impact on the body and on the health sector. So resistance to medication, because you take them here and there, you misdiagnose, the organisms become very composed because Charlie, Mr. Home,
Yeah,
I'm there. You are not shooting me. You are just missing your target. I'm growing. I become familiar with your traits.
sure.
So now every medication you give him,
They become
is a
resistant.
tool. You understand? All these things. That's where you hear them say, oh,
When you take the history, you realize this person was self-made like some years.
so this is very disheartening. This is very bad. It's a very bad act though. So the health workers and the people who are not health inclined. I mean, we all do it at a point in time. It's no good. Let's just. I mean, you might say it's not every condition you are supposed to take to hospital. Probably just be a pain or something. But the moment it keeps on persisting, first, second. I mean, you don't need to go on the third episode of the medication. Just get to the hospital. All right, this is where the medical school. I hope you have all learned something. I hope you have all considered that you kind of based from this act and also take proper and appropriate health care when we kind of suffer from certain symptoms we have no explanation to. All right, so you come your way. Maybe you have your last words to say.
So I just wanted to tell them if any of our viewers is someone that practice self-medications, please, you can kindly put a stop to that because it's going to put your health at risk.
The addiction also comes.
Addiction is a yes. We'll find time and talk about addiction. Yeah.
All right, so come away.
How many hours? How many hours?